Any thoughts on hair transplant without propecia, finasteride? First question here on Real Self. I'm 25 years old and have been losing my hair since 23. I was on a quarter of finasteride for a year and did wonders for me. All my hair came back, but got really bad sexual side effects from it around 6 months in. Had to stop taking it. Minoxidil did nothing for me. Looking at hair transplant now. Some docs are telling me I might need 2 hair transplants because I'm younger and the hair loss itching isn't stopping. Any thoughts as to the effectiveness of hair transplants without help from finasteride?
Thank you for your question. You're 25 years old. You submitted 2 photos, and you've provided very good detailed history. It appears that you started losing hair when you're 23. You were able to take a quarter of a finasteride, and you had good results in terms of your hair, but unfortunately you felt that the sexual side effects prevented you from continuing taking the medication. You're asking about the advisability about hair transplantation, and that you were given some opinions about you having to undergo 2 transplantations because of your age, and and you're asking about the advisability of doing hair transplants in the absence of a stabilizing medication. Well, certainly you're asking a really well thought out question, and to give you a little bit about my background, I'm a board certified cosmetic surgeon practicing in Manhattan, Long Island for over 20 years. Hair transplantation and hair loss treatment has been a significant part of my practice during this time. And I can certainly share with you my perspective as a surgeon about hair transplantation in men in their 20s. It is very important to understand that there is a very significant limitation of hair transplantation in the absence of stabilization. It means that you're progressively going to lose hair. And the donor area, by its nature, is limited. The amount of hair that you need as you lose more hair cannot be matched by the amount of hair that you can transplant. So in general, in the absence of stabilization, I don't recommend transplantation. Now in our practice, we've developed a treatment called hair regeneration. Hair regeneration was a discovery that is the combination of using platelet-rich plasma derived from your own blood, combining it with acellular matrix, which is used for wound healing. Remarkable thing is, in the majority of patients of male pattern hair loss, close to 100%, we're able to stop progression of thinning and reverse significantly thinning hair and make those hairs thicker. As a non-surgical treatment, we've actually been able to demonstrate that the results can exceed the results of 2 hair transplant surgeries. Now, there are some people who don't respond, but they're very few. And we watch our patients very carefully and very closely. We have 3 to 5 years of data that show no signs of patients regressing. In general, in counseling our patients, we tell them that if you needed to get an injection every 3 to 5 years to maintain your hair, it is clear, especially as long as you have hair, that it is much more desirable than having surgery every few years. But key to your surgical plan or otherwise is stabilization. As I said, if someone like yourself were to come to our office, we would start first with hair regeneration treatment. In many patients, depending on the degree of their advancement of their hair loss, we'll even do a second injection. And we'll do that in the 12 to 18 month time frame. And we have been very happy and very impressed with the results. We've been so successful with this for patients who have come to us from around the world that we have now scaled and have developed centers called Trichostem Hair Regeneration Centers. And we're trying to bring this treatment to more people. This has essentially bridged a large divide between medical therapy and surgical therapy. And patients are frustrated with the limitations of surgery. Surgical hair transplantation is a great procedure, but the candidates have to be selected appropriately. So I recommend you learn more about this option and do your research. Don't be seduced by the glamorization of different surgical technologies. It is still a limitation of where you donate the hair, which is from the back of the scalp in that limited donor area. So I hope that was helpful. I wish you the best of luck, and thank you for your question.